Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome to DocTalk. This is Brent Leavitt. I'm the owner of Battleborn Financial Advisor and Health Insurance Brokerage here in Perb. And we are joined again today with Dr. Tali Arik of Perb Cardiology. Our ongoing series is to get to know every single primary and specialty care doctor here in this town and get to know them, who they are. My office, we help people with their health insurance needs as well as the financial planning needs that they have. And health insurance is a big part of that financial plan. And getting to know who your doctors are and getting to know what they're like before you even meet them is a great thing. And I like to people to, if they have questions about their insurance, getting to meet a doctor, especially around Medicare, or even if you're transitioning from an old employer plan to your own, call my office. The number's on the bottom of the screen there. It's the 775-764-2252. And you can even book appointments with us online. We made a really cool way to do that. And again, we're here with Dr. Tali Arik. He's with Perb Cardiology, and they even have a website, perbcardiology.com. And you can actually book appointments online there too. You can get to be a new patient of theirs. I like their practice. We talked to them last week because they're kind of a mix. They do have a primary care doctor practice, which is off of Calvada, and then they have a specialty care practice, which is off of Loop Road. And we're going to talk why I say specifically Loop Road because it's we're talking about the building here. The building that he's in is actually says on the top of the building. It used to say Healthcare Partners, and as of we speak this when recording this today on the 22nd, they're now officially Intermountain Healthcare. So you will be seeing everything change to Intermountain Healthcare. But the question we had is people don't understand that Intermountain Healthcare, they actually just lease the building.
Correct.
From an investor group. And actually Dr. Arik is one of those people that leases also space in that same facility.
Correct.
So he has his own facility there. It's actually a really beautiful little area. You have your own little pod area, and you can go in and see doctors and stuff like that. What's the name of your pod again? Because they all have different names.
Ours is Juniper.
Juniper, so the Juniper
each pod has a different name. Amargosa, Juniper, Spring Mountain, Tacoma, etc.
Yeah. So you remember Juniper when you go in, that's see Dr. Arik
Right.
and his crew there. And they do have, like I said, they have the office on Calvada, which is for their primary care practice and stuff as well. So you have two different places. That changeover, a lot of people are wondering what's Intermountain Healthcare, what's going on. Nothing really is changing over at Healthcare Partners with regards to like how they treat you and all your patient records, things like that. They're just integrating with their parent company who just recently purchased them, so they're now keeping everything under that same umbrella name of Intermountain Healthcare. And a lot of people, probably a good thing because Intermountain Healthcare, they provide care a little bit differently than some of the other places do. They also, with Dr. Arik here, his contract's not changing. You're still going to be on Humana Gold Plus.
Not changing at all.
People have been seeing new contracts come in with Humana where they have new cardiologists in the town and they forget that, wait a minute, does that mean I can't see Dr. Arik anymore?
Correct.
I don't want to go to Vegas to go see a doctor when you have like one of the best ones here in Perb.
Thank you.
And he's got all these cool testing equipment here that they don't even have in Vegas even.
Correct.
We talked about the last time too. Look at our other episode from last week and say, what equipment do you have? And with that being said, all the contracts and stuff, in fact, you're working on getting more contracts now too, aren't you?
Well, in the last couple of weeks, I think 5 or 6 have approved us. So we're at a point where we're on every plan now except for HPN. We're on a Sierra Select Health, but not on the HPN. That's virtually the only one we're not on. We have an active application now for Blue Cross. We're not on the Cigna plan yet, but really virtually everything has come through in the last few months.
Yep. So you're still open to getting more out there too and trying to grow the practice. So
certainly.
You want to serve Perb.
Certainly.
So that's what we like about it. Last, I know we're going to talk a bit more in the second segment more so, but I know we want to talk a little bit about, we talked about why you want to see a cardiologist, what's the important thing about what you do. Early detection a little bit more.
Very much so.
And we want to talk a bit more about, looking at your heart health and stuff like that. A lot of us, we don't realize, I think Perb is probably on the hotbed of a lot of cardiovascular issues, but majority of us don't even know that we have them. I think a lot of people, I swear, I think the last year I've had at least 2 clients that have passed away just kind of unsuspectedly and was probably because of heart problems we just don't know about. And if you look at the size, what's going on, the signs, you're like, well, wait a minute, maybe I could have had early prevention. We could have extended their life a little bit more and lived better, right?
Certainly.
So let's talk about some of the signs a little bit more, and we'll go in the steps and stuff like that. So what kind of signs do we look at for early prevention and cardiovascular stuff?
Well, the traditional approach has been to look at risk factors for heart disease to try to identify people who should be targeted for testing. But over the last decade, we've learned that that approach still misses a lot of people who are going to have a heart attack or sudden death. So, for example, at one end of the spectrum, you might have a person who has a family history. Perhaps they are diabetic, hypertensive, let's just throw everything in there, high cholesterol, smoking. Let's say they have symptoms, chest symptoms of one sort or another, chest pain, tightness, pressure, shortness of breath. You do an evaluation and ultimately find out, well, they actually don't have any heart disease. So that's one end of the spectrum, someone with multiple risk factors with no significant disease. And yet at the other end, you can have someone with minimal to almost no risk factors who yet might have vascular disease. Now those are exceptions, but we see those, and the traditional risk factor model, which looks at diabetes, hypertension, cholesterol, smoking, things like that, only predicts accurately about half of the people who have established plaque. How do we know that? Well, there are studies that have been done using a CAT scan technology which can detect early plaque before arteries are actually blocked. And then you look at the risk factors and correlate with that, and you realize, you know, risk factors don't do that great a job at predicting who's got early disease. Now, in addition to the risk factor, that's the imaging approach where you actually take someone, regardless of their risk factors, and do imaging with a PET scanner that we have, with cardiac echo, artery ultrasound, the carotids, the aorta, the legs, to look for early plaque. And then if you identify that, yes, then you intervene. And typically intervention is on the risk factors that are promoting disease, or if you find serious disease, which we often do, then you may actually need to do an intervention, artery opening, stenting, bypassing, etc. The other population is the symptomatic population, people who have a symptom, shortness of breath with exertion that's, say, new onset, or chest tightness, pressure, new onset, or a fainting episode that had never happened before, or significant palpitations, exertional sweats, just a generalized feeling of extreme fatigue. Now, everyone who's tired does not have underlying coronary disease. I mean, the most common cause of daytime fatigue, at least in this community and in general, is poor sleep, and that can happen for a variety of reasons. So if you don't get good REM sleep or adequate quantity of sleep at night, by day you're fatigued, yes, granted. But new onset fatigue in a person who otherwise did not have that, often a subtle but definite symptom of underlying heart disease.
Okay, wow. So do they know if it's like heart disease comes from, is it a lot of diet probably that's involved with it? Is it, because it seems like about 50% of the time they can figure it out by smoking and genetics. But is there more to it than that? Is it the food that we eat a lot of times, or is it, what do we think it is that causes a lot of it?
It really, coronary disease is one of these medical problems that's what we call polygenic, meaning multiple things in the genetic code affect your interaction with your environment, whether it's diet, activity, etc. So again, we can see people with very unhealthy habits who remarkably seem relatively immune from the effects of those. And at the same time, we can see people who are fairly engaged in fairly healthy habits, but yet who develop some significant vascular disease, and then all variations on that theme. It's not a one-to-one correlation. Yes, if you look at a population, it's very clear you can identify trends. For example, in people who have already advanced artery vascular disease, if you initiate very aggressive risk factor management in those people, you can see a significant improvement in outcomes, meaning less heart attacks, less heart failure, less sudden death. So it's never too late to intervene, but there are broad trends. People who have healthier diets as a population, yes, live longer. people who are more physically active and more lean. As a population, yes, less disease, live longer.
So how do we, like, when clients meet with you and they have a lot of these symptoms, like how do you recommend, like besides medications and stents and things like that, are there other kind of treatments that you usually recommend to them that
Well,
they go a lot of times?
in our practice, because of the volume of patients that we're seeing, we don't have the ability to do separate dietary counseling. We don't have active cardiac rehab in Perump yet, which is a comprehensive way of addressing risk factors from the standpoint of diet, exercise, relaxation, other modalities to decrease risk. That ideally is done in a rehab type setting where you have a nutritionist, exercise physiologist, and supervision of activity. So we can only give general guidelines in terms of the cardiology clinic, where we're really primarily occupied with untangling people's symptoms and then testing to find problems and then directing them either to medical therapy or invasive diagnostics, such as in a cath lab in a major medical center in Las Vegas, and then interventions which could include stenting, surgical consultation or treatment, or at the end of all that, it could still be a recommendation for medical management. And all of those people who have any type of vascular disease at whatever extent diagnosed, obviously recommended for lifestyle management, as we call it, which is diet, exercise, smoking cessation, diabetes control, etc.
I'm assuming that's why your primary care practice helps a lot with that.
Tremendously. So many times someone has come to me as a pure cardiology consultation, and if they don't have a primary care physician, which is often the case, we have our two excellent nurse practitioners available, Melanie Lentz and Marquita Arajo, and they're very well versed in preventive care, diabetes management, blood pressure management, cholesterol management, and I refer them to them for that management.
Yeah. And you, like you said last time too, they've been with you. They got some really good training on cardiology underneath you for a few months before they went on their own.
5 months, exactly. So they understand the testing protocols, who needs what, and have built that in. I mean, I think that's one thing about their practice in Perump that's unique, and in Las Vegas, if you compared, that's unique, is that you have primary care physicians who have immediate access to the state-of-the-art cardiology and vascular artery testing. In Las Vegas, for example, a primary care physician would have to make that referral outside or order that test at, say, Steinberg or West Valley Imaging or Desert Radiology or at a hospital. So in distinction to that, our nurse practitioners have immediate access to that.
Yeah, that's awesome. And now you have some really state-of-the-art equipment too. We talked about it last time a little bit.
Oh,
and what's that? We're gonna talk about it after our break actually.
Oh, okay.
I looked in like, we got break time here, so we're gonna go to break.
Okay.
Come back. We'll talk a little about the equipment and some other detection stuff, and we'll see you in a few minutes.
We will return with more Doc Talk after these messages. Welcome to Doc Talk with your host, Brent Leavitt. And Doc Talk with Brent is sponsored by Battleborn Financial.
Welcome back. This is Brent Leavitt. We're here with DocTalk. We're talking with Dr. Tali Arik. Just to remind you about kind of who we are and what we're doing in these shows. It's all about getting to know our primary and specialty care here in Perump and finding more about kind of what service we have to offer here. My practice, we're actually a financial advisor and a health insurance brokerage, and we're here to help you guys with dealing with your health insurance needs and connecting you with the care that you need to get access to and making sure that your health insurance matches all your needs with getting the right doctor and getting the right people here in town. And this episode is all about trying to get to know who the doctors are, what kind of services they offer. And I always mention a little bit about insurance and how they contract. And we're here with Dr. Tali Arik again. He's with Perb Cardiology. They actually have a primary practice as well as a specialty practice. Their main office, the specialty office, is inside the same building that they share with Intermountain Healthcare. And we corrected ourselves with that because it used to be Healthcare Partners, and now it's Intermountain Healthcare as of today, officially. Even though he's not really a part of the group, but he does contract with them in all of their plans.
Yes.
A lot of people, I'm going to go back a little bit. I know before I was talking about how probably people think that while I'm on Humana and I have Intermountain or I have Healthcare Partners, and it's difficult to all the lingo that we use in this whole health insurance world is understanding the fact that if you have Humana like the Gold Plus, and I mentioned that just because it's part of this whole thing with Intermountain and all this stuff is tied to it. Intermountain Healthcare actually manages their plan for them, and they basically, all the primary cares, especially stuff like that, their contracts actually go a lot of times through Intermountain Healthcare. Humana is really kind of the insurance provider, and then Intermountain is actually the provider network that you're using within that. And even if you're not on Humana, let's say you have a private insurance like Health Plan Nevada or like Sierra Health and Life, or you even have, let's say you have like a Blue Cross Blue Shield plan, you can still access Intermountain Healthcare as well as Dr. Arik's office. And Dr. Arik actually has a plethora of contracts, and he's adding more every day and things like that. And the unique thing about Dr. Arik's office, not only does he have these contracts, so you can see him and get in to see his office, but he also has some of the state-of-the-art equipment. And we're going to talk about that. And tell us a little about what kind of equipment you have. And I think we talked about last week a little bit more, but also want to go in more depth about what that equipment does and what's different about that and why Perump, not Las Vegas.
Great. Those are all great questions and a great lead into what we have created here in Perump, which really is, I have to say, quite extraordinary. So I think the centerpiece of our diagnostics is the cardiac PET scanner. Many patients have had a nuclear stress test or a so-called non-walking stress test in the past. That's done with nuclear medicine, with certain nuclear materials that specifically allow the heart to be imaged. PET scanning has traditionally been done as a cancer imaging modality. There's also what's called cardiac PET. And cardiac PET offers multiple advantages over conventional nuclear stress testing. One is that the stress, so-called stress, is uniform. You use a medication called adenosine, which decays and is gone over a period of seconds and doesn't stress the heart. There's no increase in the heart rate or blood pressure. That's a common misconception. It actually just relaxes the heart arteries to maximize, optimize blood flow. And through the PET scan modality, we can actually measure that blood flow both in that medicated so-called stress phase and compare it to the rest phase. When you compare the flow in those phases, then you understand the blood supply to the heart muscle, and you can determine heart attack risk, sudden death risk. You can determine whether the person needs an angiogram for further evaluation or is okay with medication. The PET scanner is fantastic because a traditional nuclear stress test takes about 2.5 hours, done in 2 parts. Session number 1 takes about 25 minutes. Patient rests for 1.5 hours away from the scanner, comes back for a second session. In PET scanning, it's all done in one 35-minute session. Number 2, the radiation exposure, which a lot of people in town are sensitive to because of number 1, many have worked at the test site, they're aware of radiation and risks. Number 2, many patients here have had multiple medical problems requiring multiple imaging modalities. Traditionally, a CAT scan is basically equal to half of your annual recommended radiation exposure. So 2 CAT scans or 1 nuclear stress test and 1 CAT scan, and that's your maximum desirable radiation exposure as a patient per year. Well, we have patients who have 8, 9, 10 scans a year for different reasons. A PET scan is done with 1/10 of the radiation of a CAT scan. So you'd have to do 20 PET scans of the heart to get to that maximum allowable level. So the scanner is dramatically effective in imaging the heart without exposing people to radiation. The third and very, very important thing about PET scanning is clearer images. There does not have to be any adjustment for body size, body shape, weight. Images are perfect regardless of body size, shape, or weight. So we have dramatic advantages with PET scanning over conventional nuclear scanning. There are only 250 of these scanners in the United States. There are 10,000 of the other kind. Half of these PET scanners are at university hospitals. So really, there are only about 125 available in the United States. So that's the centerpiece. and that's to diagnose coronary disease and assess heart attack risk and sudden death risk.
So the PET scans are huge out there.
Yeah.
You don't have very many of them out there, too.
No, it's a modality that's just not commonly available. You can get a PET scan at one practice that I know of in Las Vegas and at Mountain View Hospital. You can get a PET scan at Renown in Reno, but otherwise, that's it.
This is it, yeah.
Yeah.
Now, how do we know that we need to get PET scan? Is it something that do they, certain age, do they start getting these kind of things done? Is it certain factors, or how do they kind of know that I probably should look into getting this done?
So there is a way to assess cardiac risk based on criteria and or symptoms to determine whether you would benefit from getting a scan. You don't want to scan people who are basically low risk. For example, a 36-year-old woman with chest pain and no risk factors for heart disease is not going to be likely to have coronary disease. So you don't want to test people who are low likelihood. The higher the risk the patient has, the more likely you're going to pick up disease. Okay, so that's one approach. Second approach is the person who has symptoms. Any symptom that's suggestive of heart disease is important to study and scan. And we've seen in this community people even in their 20s in whom we've identified significant heart disease through scanning. That's focused testing. You're not going to test everyone in their 20s. That would be ridiculous because the likelihood of finding disease is low. But you target your approach, especially in the 20s and 30s. And once you're in the 40-plus range, then virtually everyone is a reasonable candidate to have testing for coronary disease. After all, coronary disease is still the #1 cause of death in the United States in people from the age of 40 on up.
Yeah. So we really need to take care of ourselves, especially even in our 20s. It's like you never know when you're going to have something.
Well, risk factor modification begins with good habits in childhood and teenage years, and ideally continues on. But I can't stress enough with heart disease and vascular disease, whether it's carotid, aorta, leg artery, any kind of artery disease, you can almost always intervene from the point of diagnosis before something bad happens. And the bad things that happen are bad: strokes, heart attacks, sudden death, a compromise of circulation to an extremity. These are all critical problems when they happen. So once you detect problems, a lot of the patients ask, gee, can you reverse plaque? Can you get rid of it? It's not so much that, because we don't really have good evidence that you can do that once it's fairly advanced, but what we do know is you can stabilize disease. You can keep it from progressing, and you can keep plaque from causing a heart attack or stroke.
Okay, yeah. You know, it's the more I've been doing these interviews, I look back and we started off with Dr. Hazlett and we talked a lot about weight loss and different things, and eating right and changing our body styles. And I've noticed me personally, I'm like, okay, I've all of a sudden trained my eating habits a little bit with my wife, and we're trying like, let's lose some weight a little bit. And then we talk a little bit more about, testing diagnostics and stuff like that. I'm thinking, okay, what am I doing differently in my life? And all those things, it's been changing me a little bit. One thing I've always done, and I always recommend everybody do, is every year, every health insurance policy out there gives you an annual physical at no cost to you. I don't care if you're on a high deductible HSA plan or a low deductible plan, they all include an annual physical at no cost. And getting to know your primary care doctor, getting to see them at least once a year, to go in and say, hey, wait a minute, am I at risk for heart stuff? I mean, should I see my cardiologist? Should I see Dr. Arik? What do we need to do? I mean, get to know your primary care doctor and utilize that insurance. And that's why and insurance, I don't care if you're like, man, I bought the cheapest thing that has the worst deductible ever. I called Brent's office and they worked with me on that. I get that sometimes, people they're barely scraping by to pay those insurance premiums, and it's like, I got this huge deductible, and you're thinking, I can't afford whatever I need to get done. But I'll tell you what, you can't afford of what can happen if you don't take care of yourself. If you're not seeing your primary care doctor, getting that free physical, and then saying, hey, I need to see Dr. Arik, it's just a copay for a specialist to go see him.
Right.
I mean, yeah, if he needs to do some testing, it might cost you a little bit for the diagnostic stuff, but I mean, honestly,
it's actually not that much. I mean, we have a flat fee for people, for example, with no insurance. Oh, nice. You could have a $50 echocardiogram, you get that for $150. Or you want a carotid ultrasound, it might cost $250, but you can get that for $150 as a cash pay.
Exactly. I mean, they work with you and make
there
it
are
so-
different ways to get these things done. I mean, here's a great behavior modification tool. There's a study that was done once of people with carotid artery ultrasound, and if it showed that if you gave people a picture of their carotid and they put it on their refrigerator, it actually changed their behavior compared to people who did not get the photo to put on their refrigerator.
Very much true, yeah, exactly.
Daily reminder.
Just remember, you keep yourself healthy and do all these things. And that's one of the things I look at, the fact that you invest a little bit in your money on yourself now, your health. You'll save yourself lots of money in the future. Like your future self will thank you because you're going to live a lot longer. You're not worried about going to the hospital.
The focus should be not just on living longer, but living better.
Better, exactly.
Because that's actually much easier to achieve.
Yeah, exactly.
Anything you can do to decrease your likelihood of hospital admissions, doctor visits, long medication lists, those are good things.
Enjoy, and avoid those now, because I tell you what, and you get older and all the, you get closer, your body doesn't work like it used to back when you were younger,
I can relate to that, unfortunately.
And the costs go up, especially when you want to retire, and it's the biggest financial burden is if you don't take care of your body and yourself when you're younger. When you're older, it catches up to you at some point or another, whether it be plaque in your arteries or whatever's going on, so. But our time is up here, and I want to thank.
Okay.
I want to say
we could have talked about more things.
I know, yeah, always. Love to have you back again.
Come back.
But we'll talk to you guys next time, and feel free to call us. You have our number, Battleborn Financial Advisor, and Perb Cardiology. We'll see you again.
Thank you.